right, let's get started. Thank you everyone for joining. Today, we're going to be discussing how Ardent Health CHRO hired and retained 32% more nurses in just 1 year. Thank you everyone for joining. What we'll be doing today is we'll be doing introductions. We'll go through an agenda. We'll go through a quick overview of the market. And then we'll be speaking with our awesome speaker today. So my name is Iman Abuzaid. I'm an MD by background. I'm the CEO and co-founder of Incredible Health, which is the fastest growing and largest marketplace for permanent healthcare workers in the US today. Incredible Health is the only platform that allows hospitals to hire permanent experienced nurses in less than 20 days. And we flip the script where hospitals and health systems apply to nurses, not the other way around. So joining us today is Carolyn Schneider. She's the CHRO at Ardent Health Services. Ardent Health Services is a leading provider of healthcare across the US. Through its subsidiaries, Ardent owns and operates 30 hospitals and 200 sites of care with more than 1,400 aligned providers across 6 states. Carolyn has served as CHRO or as a top HR executive for over 20 years in healthcare technology, and briefly in global manufacturing. Many of the places where she worked got the award of Best Places to Work recognition for many years. Her work using early entry AI tools to expedite leadership recruiting was highlighted in Computer World and PC Week. She has been recognized as a woman of influence by the Nashville Business Journal and was spotlighted by the American Health Leader. We're thrilled to have you today, Carolyn. Thank you so much for joining us.
I'm thrilled to be here. Thank you, Iman.
Awesome. So this is designed to be an interactive discussion. This webinar is recorded as well. A member of the Incredible Health team will be in touch with a recording afterwards. And if you have any questions, please feel free to submit them in the chat. We'll answer them throughout the webinar. And also we have time at the end dedicated for Q&A. All right, so today we're going to be covering the state of the nurse labor market, just so we can set the scene of what's happening now. We'll review with Carolyn some of the challenges that her team has been tackling, their HR transformation, how she was able to drive nurse retention and nurse hiring. We'll be covering how Incredible Health helps a variety of health systems, and then there will be time for Q&A. All right, let's get started. It's great to see there's lots of names I recognize, including members of your team, Carolyn, which is awesome. All right, so let's start with the market. So what's happening? Like, our demand for healthcare as a country keeps increasing, right? Our population is aging. There's more and more demand on the healthcare system, but we as a country have not kept up with the number of workers we need in healthcare. Even though the number of healthcare workers has grown year over year, it's still not enough to meet the demand on our healthcare system. We now have 1 in 8 Americans in the country working in healthcare, and healthcare has been the #1 employment sector by number of workers since 2018. So this is a national problem. It's a challenge in every state. We're on track to be 1 million nurses short by 2030. The annual acute care nurse turnover as of early 2023 is at 22.5%. Also, labor as a percentage of revenue continues to increase. It's at 48% for the publicly traded hospitals, and that's because labor costs continue to increase, not just from temporary labor, but even the wages of the permanent healthcare workers continues to increase. And then the average days to fill for a permanent specialized nurse in the US today is at 95 days. That's the national average right now. All right, so when nurses are signing up on Incredible Health, we ask them, why is it that you're considering leaving your current job? And we have over 800,000 nurses on the platform now. So what are they saying? By far the top reason that's selected is I'm looking to advance my career, right? So that might mean they're looking for career mobility, they're looking to cross-train, they want to move into management, they want to expand their skills, something to do with advancing their careers. The second most common reason is that they're looking for a better schedule. So the days of 12-hour shifts, 3 days a week, full-time only, are essentially over, and they are looking for more part-time roles, 8-hour shifts, 4-hour shifts. They just want more flexibility. The third most common reason is something to do with geography. They want to either reduce their commute time or they want to relocate altogether. And our platform shows that 35% of hires on the platform are relocating from a different state. So especially the Gen Z and millennial generations, I mean, these are two generations that definitely move for work across all industries, not just in nursing. And then finally, it's they're looking for better compensation, perks, benefits. And so many health systems really need to have to keep up with both salary and benefits. So when we're working with many HR leaders and nursing leaders across the country, there's a lot of focus and emphasis on number 4. But oftentimes there's not as many strategies and tactics for number 1 and 2, even though the majority of nurses are asking for number 1 and 2. We also do studies here. So one of our recent ones from earlier in 2023, what are the top concerns that nurses have? I'll mention just a couple. So certainly 73% are still concerned about staff shortages. There's a portion concerned about limited career advancement. Still lots of concerns about their work environment and their safety, and then concerns about salary and benefits. All right, so I'm gonna bring down the slides for a second, and I want to turn over to Carolyn. So Carolyn, we'd love it if I shared a national overview, but we'd love to hear your perspective on some of the challenges that your health system was facing when it comes to the topic of nurse hiring and nurse retention.
Yes, thank you, Aman. We're no different than anyone else. We're facing the same issues, right? We've talked about talent wars for a long time, which I never liked that phrase, and I never used it. But today, I think we really have to think about that. We are short on nurses and physicians, and so we have to think of different ways to engage and different ways to bring people in and create, what I call loyalty in the system. And so, but yeah, we're facing the same challenges. Contract labor, people want gig work, people, want to move, they want career opportunities for those that we have. So we're not unlike anybody else.
And so you have over 24,000 employees, many thousands of nurses. It's like,
yes.
And so you also, where you say have, can you share a little bit more about the challenges you were having with just retaining the nurses?
Well, during COVID, I think everyone was going through this because there was the appeal of the gig workforce, or at that point in time, people really didn't think about it that way, but just the travel nurse phenomenon, right? So you had this opportunity now as a nurse, if you were in a rural market, to really go out and see the world, if you will, if you were unencumbered, and to get paid a lot of money. And I know a lot of people who did that. They said, this is my one opportunity to do this. If I'm going to be having to work in COVID, this is the kind of thing I might as well get paid for it. And so we sort of, it was the onset of sort of the gig worker for healthcare and for nurses specifically. It stretches to other parts of the job market as well, because we had the same issue around surgical techs and some PCTs and things like that because of what was happening both in the market dynamically as well as from a compensation perspective. So we had the same problem set that many of our peers had, and we're all competing from the same ones, same pool of nursing. I could talk about one of my markets, and in one market specifically that I'm thinking of, we would start, one of our competing hospitals would change the starting base rate $4 an hour. The next one would have to do the same. And then of course we would have to do the same thing. I mean, and we were just basically cannibalizing ourselves in terms of the labor market, and no one was better off. It was just, just an increasing compensation structure.
Absolutely. So yeah, in any market where the supply is short and the demand is high, wages increase. So you're tackling pressures on compensation, intense competition for the talent.
Right.
You also the whole travel nurse phenomenon was particularly strong over the last couple of years.
That's right.
Anything else in terms of just challenges you're trying to tackle?
Well, I think for us, because we were coming into the organization, we were really set up as a holding company. And so we had 5 different ways of doing things. We had 5 different divisions, and each division did something different. And so that created problems in itself, right? Because we were not sharing best practices. We were not, we were doing repetitive work across the organization, and so we couldn't capitalize on that. And honestly, the way we were structured, for our recruiters, I'll tell you more about this later, but our recruiters are based in the hospital. They're hospital-based recruiters, and if you're based in a hospital, you're recruiting the kitchen sink, right?
Yep.
I'm going to recruit a pharmacy tech today. I'm going to recruit a nurse tomorrow. I'm going to hit a director the next day. So you don't really get good at your job, and you have people who come in and say, "Yeah, but could you go file this for me too while you're at it?" So a lot of other duties as assigned when you're in that hospital-based recruiting role.
Got it. Yeah, I know with attendees from all over the country, and that the phenomenon you're describing is actually quite common, especially in health systems that have more than one location.
Right.
Where it's very distributed, it's not specialized, there's no shared services, etc. Right?
Correct.
Okay, so we'd love to hear just overall, like, what was your overall strategy for tackling these challenges?
So the first thing, we were coming into Ardent 2.5 years ago. Our leader had a vision about moving the organization from a holding company to an operating company. And in order to do that, we had to really take a deep look at HR, how we were structured, and how could we capitalize on the people we had in the field. So I took my HR leadership team offsite. We workshopped this and came up with our new HR operating model, which would be radically different than what we've had in the past. Historically, we had a few people at the corporate office. This now changes the reporting relationship, but we needed to do that in order to get the buy-in and the work done. We socialized that with our CEOs out in the field and just basically went out to them and said, okay, here's what we're thinking. We've done work studies on every single person that touches HR. We see all this overlap and all these projects. We had 6 different projects going for onboarding. And it was interesting because when we looked at the numbers, none of them were working because our highest level of turnover was in that first 90 days. So, excuse me. So we asked the CEOs, what worked, what's working for you now, and what do you need more of? What do you need less of? So try to get their buy-in, and then we've changed the operating model and tried to keep them abreast the entire time that we were doing this. Now, that was not an easy feat because we had a lot of people who were invested in the roles that they had, and we were redefining their roles, and that was obviously change for people, and sometimes change is hard.
Okay, so the outcome, like, we fast forward to the end. The title of this webinar is a 32% improvement in retention, right?
Correct.
So what did it take to go from what you described around, like, you wanted to implement a new operating model to that success of the 32% improvement in retention?
So there are two concepts in my view, and one is, how do we create loyalty in a world that rewards disloyalty? And by that, what I'm saying is, I've looked at all of these wonderful TA systems and resources and tools, and people can ping people on the phone, and I'm like, that's what I want for my company, right? I want to have the very best and most up to date, but I also recognize that's what other people want. So if I'm recruiting from that perspective, so are others. And so all it takes is a cell phone these days, right? And you can get enticed to leave your job or go across the parking lot, in our case, because we have hospitals that compete with us literally across the parking lot. So there's no geographic change, but they can make 50 cents more an hour. So really building that loyalty, figuring out how to build loyalty into the organization, which meant sort of turning our strategy around talent management around. And so instead of being an acquirer of talent, we decided that we needed to be a developer of talent. And when I say that, I'm talking about even at the lowest level, from a PC tech to a CNO, right? As we think about sort of that journey that our employees would take. Because if I invest in my employees, in my team members, then it's going to create some sense of loyalty and some stickiness to us. And so that was the first thing. The second thing was, okay, how do I build an efficient and scalable model as we grow the company? Yeah. And so we did some radical things. One thing we did was, there's two major things that people have that's really changed. We created a shared services organization. So we now have an HR service center where we had typically had people holding folks' hand. We don't want to take the human out of it, right, at all, but we do need to leverage some technology to help us and to help us use our practice at the top of our license, just like our nurses would.
Yep.
The other thing we did is we took the recruiters out of the hospital. That was a big radical shift because our CEOs were like, but we need these people here. I want my recruiters here. I've got to be able to access them. And we said, well, why? And what's wrong with people working remote? We can give people a satisfying experience. We can also use the entire nation to recruit from and have some of the best recruiters in the country, as long as we give them an opportunity and we treat them fairly and pay them well, and et cetera. So why do they need to be in the hospital? And so somebody said, well, because we have walk-in days, Carolyn. And I said, oh, I hadn't thought about that. That's a good thought, but how many people are we recruiting on walk-in days? And there was crickets. So we changed the model entirely. That model changed, and we created specialties for our recruiters. Everyone is in a vertical. So we now have people who specifically recruit nurses only, allied health, professional, et cetera. And so because we created this specialization, people could build deep knowledge and then wide networks, which is what my sort of platform is how do we do this? Because we know if people have deep knowledge, wide networks, it accelerates the speed to hire because you're doing the same thing over and over again. And so you know where to go get people. I think that was the biggest radical change for the organization. And while we did get some noise, that is smoothed out now with the results that we've seen. So it's been really good. And then we've started, we invested in heavily in learning and development. And so we have now done role mapping, journey mapping for our different jobs that we have. And even for our HR teams, we've done an HRBP learning series to skill up our people as well, because we want to take them on the journey with us, not leave them behind.
Just to share a little bit of data on our side, the average nurse recruiter using the Incredible Health platform, we have hundreds of nurse recruiters using the platform. The average years of experience is 10 years of that recruiter. And this, I think many people underestimate the amount of specialization needed to hire for some of these roles. I mean, the truth is like nursing has 45 plus specialties. It's very competitive, as we mentioned earlier. I mean, we need recruiters who are at the top of their game, right?
Right.
To hire in an environment like that.
That's exactly.
Would love it if you could share a little bit more. You had shared some data with us. And then we'll go into a little bit more detail on your strategy.
Yeah, this slide is one that I shared with our board in our last board meeting in September. But this is for Q2. We've had a 25% decrease in year-over-year turnover altogether. So that's all turnover, but a 32% improvement in nurse turnover. So we're really pleased with that. Our numbers are the lowest they've been in terms of nurse turnover since I've been here. Our engagement scores, again, the first engagement survey we did in 2021 when I arrived, our engagement was at 68%. And most recently in July of this last year, we were at 82%. So some of the things that we're putting in place, and look, I can't say that HR does all the work here because that wouldn't be true, but I've got some great leaders. And we're creating a culture in which people can thrive and feel like they belong in our organization. Really have done some great work with our DE&I folks, our women at Ardent. We have a lot of different ways to create a great culture and keep people engaged here. And then in terms of hiring, back to this team member hiring, so this is, we ripped the Band-Aid off the TA model in June of last year. And then, as you can see, we've had a 10% increase in total hires year over year and a 32% increase in nurse hires. So 1,214 nurses more than we did the year before. And it's interesting, I'm sitting here looking at, also I have some stats on just quarter by quarter, and just to give you a point of reference, in Q1 of 2022, which was before we changed the model, our team had recruited 942 nurses. In Q2, that went to 1,016, but in Q2 of 2023, we were at 1,345, so up 400 nurses from where we started in a quarter.
Great. Those are phenomenal results. So this is your turnover?
Yes, that's our turnover, and how we look at RN turnover. You can see we've gone from basically one is voluntary, one is involuntary, and we really pay attention to the voluntary, which was at basically 22%, and now we're 14%. And this is all of the company, so going from 25% to less than, well, right now it's at 17. That doesn't even reflect today's numbers. That was in July. So we're really excited with the numbers we're seeing.
Yeah, that's great.
Yes, as you can imagine. And here's our team member experience. The other thing that we started doing was surveying our new hires, right? So as we brought them on board, because we did see the 90-day turnover was really high, we decided, well, we need to understand and create an early detection system. And so what we've implemented were surveys at 30, 60, and 90 days to really take a look at how are our team members feeling? Are we promising what we said we would do? And then we get, the early, like I said, early detection. So if there is an issue, we can go address that individually with that person, with that leader. And then this is our engagement. We call our engagement survey the heartbeat survey. And as you can see, we started in August of 21 at 67% and finished in June this year at 82%. So it's and these you can see the engagement scores, just 3 key factors: the manager inspiration, the willingness to recommend, and the sense of purpose. And I have to tell you that our purpose is one that drives a lot of our engagement, because our purpose is caring. We care for people, both our patients, our communities, and each other. And we do the each other we emphasize quite a bit.
Okay, so we have a few follow-up questions for myself. There's also ones coming in from the audience too. I think many people are intrigued by these results. First is, like, how did you get consensus from the local executives? Because that's a huge challenge for many leaders. How did you actually pull that off?
Well, the first thing, there's two ways to get to that. One is data, right? And so for us, when I came into Ardent and I looked at the numbers, and we talked about some of the processes and practices that we had, one of the things, we had a lot of manual processes. And so one day I did the quick math, and I said, it takes 10 minutes to do an address change here at Ardent, and 3 people touch it. So if I just do a conservative number, that costs us $70,000 a year. That's just for one address change, or just address changes. What about all the rest of the transactional work we do? And that's that's one of the ways that we got the buy-in for developing a service center, right? Because it had to pay for itself, and here was a way that we could pay for itself and lift all that transactional work off our people in the field, so that we could let them do higher value work. Secondly, I mentioned earlier, one of the things that we did early on was we brought the CEOs of the hospitals into the discussion early and often. We built a transformation hub so that we had communication for people, so they'd know where we were on every step of the journey. We held town halls. We held, one-on-one meetings with our regional presidents. There are multifaceted ways that we communicated what we were doing, and their buy-in. Now, I have to tell you, not all of them bought in, right? They were used to doing things their own way, but as they saw the model working, they really began to be believers. And so they're some of what I call my best customers now.
Great, that's awesome. A question that came in, just, I think many audience members are intrigued by the recruiting model change.
Sure.
When you say you took them out of the hospital, are you referring to allowing recruiters to work remote, or are they
Yes.
still focused on covering just one hospital? Are they covering multiple now? Like,
So
share a
we've
little
got
more
it.
detail.
We've got it set up where there's some load leveling. So we have it's organized by segment. So what is your specialization? And it is across. There is a geographic preference, but we can do some load leveling. So one of the things that we did is we've conducted 3 sprints in the last year. And when I'm talking about a sprint, it's a very highly focused sprint where we are trying to drive certain results. So when we were first moving to a new platform, we moved to a new ATS platform. And when we were moving to that, we had these jobs that were over 120 days, and there were like 600 or 700 of them. And my team came to me and said, "Can we just close these out, and then we'll start over?" And I said, "Well, the problem that I see with that is then we'll overstate the number of fills, and we will overstate the number of recs that for the recruiter load. So since we're trying to get a gauge, let's attack that with one of these sprints first, and then we'll, whittle that away." So that was the first sprint that we did. And that netted, we netted about 44% yield on what we were trying to achieve there. So we felt pretty good about it because we're talking about 700 jobs, and these are side of desk. The sprint is a side of desk activity, but we also incent our recruiters on the sprint. So we build different incentive plans. So the second one was focused on a location, so what I call a hotspot, right? So as I tell my team, I said, I need smoke jumpers, right? So I want my smoke jumpers to go into the hotspots, put out the fire, and then pull them back to their regular jobs when the fire is out. So we really think about our recruiters in a different way. At least I think about them in a different way. And we actually don't even call them recruiters. We call them talent acquisition consultants. And then the third sprint was, again, it was an RN focused sprint. And every time we've done a sprint, we've yielded better results every single time. So there's a lot of different work that we've been doing that's trying to be innovative and to fill these positions, because we're just like everybody else. We've got a lot of contract labor.
Yeah, love the idea and concept of sprints. I mean, we use it in the technology world with engineering as well,
Yeah,
in agile
exactly.
development. That's great. One of the Sue asked a question. Was there any concern about? Is there any remaining concern around recruiters not being local, that they're not working with local nursing schools or local events?
No, there's not, because we do have recruiters working from home. And here's a anecdote. We have facilities in New Jersey, and there was some concern about they needed some help, and we had people from the state of Washington helping the people in New Jersey. And so once they saw that we had people that could focus on them from any location, we really won over the hearts and minds.
Yeah. So this, what you're describing does require quite a shift. It's a cultural shift, right? In mindsets and behaviors. I want to touch a little more on the culture of talent development. How did you sort of turn that around or instill that into the organization?
Well, we're still working on it, but part of that's driven out of need, right? And what is it? I forgot the saying. It goes something like, the brilliant ideas come out of the necessity, right?
Yeah.
And so we started early on anchoring with some of the academic institutions, and I have a separate recruiting team that focuses just on the academic institutions. And so we anchored ourselves into those relationships. And in fact, one location, I'm not going to mention it, but we've got this partnership with a academic institution, and they produce 800 nurses a year in 3 different cohorts. And we weren't really getting any of those people coming out of the graduate programs. And so I had lunch with dinner with the dean and several other people. Again, I can't take 100% credit for this because the regional CEO sort of helped drive some of this. But we sat down at dinner and I just said, hey, why aren't we, we've got this partnership going, but we're not really seeing any results. And the individual said, well, Carolyn, y'all haven't acted like you are interested. And I'm like, are you kidding? Okay, what do we need to do? How do we do it? What can we do to help you and help drive this relationship? And so we implemented and executed on some of those things. And I think our first, we had up to, I think 160 externs. The last time I checked it, that was from 0 to 160. And then of those, I think about 60 of those students were graduating, and we absorbed 58. Something like that. So it's starting early and often, and then developing them as they come through the pipeline. We're actually going to do like other healthcare systems, a travel nurse pool that will be employees of Ardent. But one of the things that we're developing is a residency track with this particular institution, and then where we would train them on all of our systems and processes, but then also have a module on travel, being a travel nurse, and how to do that well in terms of socially and what have you. So that's our next step, is to do this residency program. And again, it gives those students another option, whether if they don't want to stay in the area, then they can travel to any of our facilities.
Okay, and the goal around the investment in talent development, that's to keep driving down to keep improving retention.
Correct. It's to build loyalty, honestly, and invest in our people, to watch them grow. Because look, at the end of the day, we've been competing with McDonald's and Walmart for talent in some of our PCTs or what have you, and we have to show them a path, and we have to make sure people can see themselves in a role that's different, because it's rising tide lifts all boats, right? And so it helps our community, it helps our facilities, it helps our people.
Another question that came in was just about your hiring managers. So you mentioned that you sort of like the shared services of your talent acquisition consultants, but at what point are the hiring managers involved in interviewing and processing hires?
100% involved, right? We try to. We've developed relationship with a hiring manager. So our teams, our talent acquisition teams, actually will go in and they do, sort of postmortems after the sprint, right, for one thing. And then we have really worked around problem solving with our hiring managers, so that we become much more partnership. Our talent acquisition teams is much more partnership with the hiring managers than they ever have been. And as people like it, they like that relationship, and it's working.
All right, let's go deeper into the topic of nurse retention.
Okay.
You mentioned a few of your tactics so far to drive retention. You mentioned the talent development piece, but can you share a little bit more about your strategies for continuing to improve nurse retention?
Yes. I think, like I said, much of it is sort of we've created career ladders. We're looking at our scheduling. We've done a lot of work around, we have a software that can allow people to opt in for a schedule, to give them that flexibility. One of the things that we did, which was kind of interesting, coming into Ardent, our LMS system was set up where only supervisors could assign courseware to anybody, but particularly nurses as well. So if you were a nurse and you wanted to learn another specialty, for example, you had to have your your manager, your supervisor, go in and assign that coursework to you. So they had to agree. They couldn't actually just do it themselves. So we flipped that upside down and we changed that out. And actually, we ended up changing LMSs too, so that people could go in and they could take as much courseware as they want to better themselves. And that's not just nursing, but all of our people. We've improved our tuition reimbursement and our tuition reimbursement policies and practices. We have, like I said, we're doing these onboarding surveys to capture their voices early in the process, so that we can respond appropriately to keep them here and reduce that turnover. And, we ground ourselves in our purpose. We try to care for our people. We've put in safety programs, because we're concerned about the rise in violence against our healthcare workers. We are doubling down on that to again, these are just Maslow's hierarchy of need. When you think about people need to feel secure and safe and have the things they want. And again, we've, like everyone else, we've also increased their pay.
Yeah, got it. Okay. So you mentioned earlier a phrase called journey mapping.
Yes.
What does that? Could you share a little more about what that means?
Yes. So I'll take, for example, if you have a patient care tech, walking them through where does this position lead? So if we would take our patient care techs, we could invest in them, get them certified to go to the next step to be an LPN or depending on the state. And then we could invest in the LPN and get them to an RN and so forth. And up to nurse supervisor or charge nurse, or nurse supervisor, CNO, what have you.
Yep.
And so these are, we want people to understand, where do I go from here? Is there a future for me inside of this company? And how do I get there? Even with our HR folks, for every job description we developed during this process, we said, okay, this position leads to this one. This is your next step, and so forth. So it is that's what I refer to as journey mapping.
Okay. Great. So there were you had mentioned just this shift from being a acquirer of talent to a developer of talent.
Yes.
I guess tactically speaking, what does that mean?
Coming back to investing in our people, right? Helping people acquire other skills, opening up the LMS so people could do self-learning and continue to challenge themselves. Letting people, we did talent reviews across the organization. Those had not been done before. Again, being a holding company, they might have been done in pockets, but we said, okay, we're going to look at it across the company, and we're developing programs. So we've got a COO development program. That had a little bit. It was mainly a locally based program, but we're actually saying, okay, what are the competencies, the base competencies we need for people to be leaders inside of our organization? And so we established a base competency level, and then from there we can grow CNOs, CFOs, COOs, et cetera. So really looking at how do we continue to challenge people and move them through the pipeline of the organization, because, we are, not all of us are going to be here forever. We are planning successions. We're doing all kinds of things to help move the organization and the people in it, because people want that. They want to grow, and they want a place where they can grow.
Okay, and then earlier you also mentioned loyalty, right?
Yes.
And just trying to drive on loyalty from team members. How are you rewarding that, or how are you thinking about driving the loyalty piece?
Well, when I think about loyalty, yes, there is some of the tools you can do with loyalty around retention bonuses and that kind of thing, but it's really more than money for me. It's really that intrinsic value of feeling like you belong in an organization, so much so that you don't want to leave. And we've had people leave the organization and then turn around and come back because the grass isn't greener on the other side. It may pay more, but it's a short-term view, and we really want the long-term view. We want people to feel like they can grow their careers with Ardent and our affiliates, as well as here at the corporate office. So I think that's what I mean by loyalty. It's not paying people. It's a gratification from your role, from your job, from the people you work with. And again, coming back to that sense of belonging. Okay,
got it. So just to summarize your strategy for nurse retention,
yes,
which is ultimately the title of the webinar, right?
Yes.
You had a range of tactics to drive that. You had the journey mapping, there's tuition reimbursement, you're doing talent reviews, you have onboarding surveys, you have touch points at 30 days, 60 days, 90 days, like a detection system. You're investing heavily in nurse education.
Yes.
Sounds like there's also some partnerships with academic institutions too.
Absolutely, yes, a lot.
And you're changing the whole mindset from acquirer of talent to developer of talent.
Correct.
That's a very multifaceted a range of tactics that you're doing to drive retention, but that's what it takes, right?
Yeah, I don't know how you everybody's different, right? So what we're doing appeals to people in different ways. And so if we're going to do the greatest good, we have to think about multifaceted ways to drive retention.
Yeah, absolutely. Okay, we'll what we'll do next is I'm going to share a little bit about what Incredible Health does, and then there's the rest of the time we're going to spend on Q&A. There's quite a few questions that have been submitted. Well, one of the questions I always ask speakers at the end is, what are your top 3 tips for your peers across the country for driving, nurse retention or nurse hiring? And so I'll let you think about that while I share a little bit about Incredible Health.
Right.
Great. So Incredible Health, we are a software company. We're based in San Francisco. We operate nationally. Our hospitals that we partner with use our custom matching technology to hire high quality permanent nurses in less than 20 days. We're used by over 700 hospitals and health systems across the country, including very large ones like HCA and Tenet. We work with many academic medical centers like USC and Cedars-Sinai and Johns Hopkins, and lots of regional systems and community hospitals too, like Baylor Scott and White, Wellstar, and others. So what is it that we do? The first piece is that the employers apply to the talent instead of the other way around. And as you can imagine, the nurses absolutely love that because they create a profile, they sit back and relax, they get interview requests from different employers, and the nurse gets to choose which interviews to accept or decline. So this is a very nurse-centric or candidate-centric platform. On top of that, we use proprietary screening and matching using our technology in order to make sure that it's a personalized and curated experience for both sides of the marketplace. And then there are customized data analytics reports that we're able to provide because our marketplace produces an enormous amount of data, which leaders like Carolyn and others across the country can use it to further identify any bottlenecks or any changes to their strategies. So as far as just getting nurses on the platform, we now have over 800,000 nurses on the platform. That's 1 in 4 nurses in the country. We offer a whole range of free tools and services to them. We offer free continuing education. We have free salary estimators. Nurses on our platform get access to career coaches, or what we call talent advocates. They get access to a community where they can ask each other questions. We have lots of other tools and resources. Everything on the Incredible Health platform is 100% free for nurses. I did want to just mention the topic of speed. Carolyn mentioned earlier this topic of sprints and just like really increasing hires. The speed, what we're finding in our data is that speed is actually the top competitive advantage when it comes to nurse hiring. And in every single market where we operate, it's always the health system that has the fastest hiring speed that hires the most, more than the health system with the highest compensation or the health system with the biggest brand. Data from our marketplace shows that 68% of nurses accept the very first offer they receive, and 61% of nurses accept the very first offer, even if the next offers have higher compensation. And so that just really speaks to the competition, and also the fact that nurses are often overworking, frankly, during their job search. So they really do appreciate the employers that are giving them a delightful experience that's fast and efficient. As far as just the results that we drive for the health systems that we work with, this is the different steps in the hiring process. For this team, this happens to be a team in the LA area. We were able to reduce the days to fill from 66 days down to 19 days. And ultimately, that drives enormous cost savings for the health system. Because by reducing the days to fill in that way, the health system is able to reduce the number of travel nurses too, because they're hiring permanent nurses faster. We also track retention very carefully. So the retention on the Incredible nurses hired through Incredible Health is usually about 15% higher than the hospital's baseline. The reason for that is because our network does skew a little bit more experience. So the average years of experience on the platform is about 9 years. And the nurse was able to consider multiple opportunities before selecting one employer. And so this is a very well thought out job search, as opposed to just taking as opposed to a less well thought out job search. This is how we work together. When we partner with a health system, this is a true partnership. It takes both parties, Incredible Health and the health system, to make hires happen. Everyone roughly has the same 8 steps. We do a lot of the heavy lifting in the first 4 steps: sourcing the nurse, making sure they're actively looking, qualifying them, and getting that first phone screen scheduled. At that point, the health system is taking over. They're completing phone screens, getting their hiring manager interviews done, sending out offers, and getting offers accepted. So it's a true partnership. We do talk about nurses needing to operate at the top of their skill set. We also need our recruiters and, we call them talent acquisition consultants, to be also operating at the top of their skill set as well, which is engaging with talent and building relationships with hiring managers. Some of the more administrative work that's involved in hiring, such as sourcing, for example, some aspects of sourcing, as well as just confirming their information and so on, that can be, we can use automation and technology for parts of that now. All right, let's turn over to the Q&A. Just a reminder, I'll also include our email here, questions@incrediblehealth.com, in case we run out of time and you have additional questions. Feel free to email us, and a member of our team will be in touch with a recording of the webinar as well. And if you have any interest in signing up to learn more about Incredible Health, my colleague Danny will also be sharing a link. All right, so question from Ali is, you mentioned for the talent acquisition consultants additional incentives to drive the sprint or to drive the side of desk work. Are you able to share a little bit more information about what you're doing there, Carolyn?
Yes. So what we did is we really set up an incentive system so that, and we're still refining it. The last one I think worked the best, but where you have a base number of candidates that you secure that are hired. When you hit that number, then the incentives kick in. And then for each incremental hire after that number, the incentives continue to go up. So if you get, and I'm making this up, but for example, this is a 60-day period, if you get 20 incremental hires outside of the side of your desk work that are focused on the sprint, then maybe at that 20, you have made quite a bit of money, but you get 21 because you might get another, pretty big, sizable incentive. So it drives sort of that, it drives motivation in one way, and then just that incremental, discrete level of performance. And so it's worked really well that way. So like I said, we're still refining it. There's the next phase is making sure that we're measuring the quality of hire, because that's part of it as well. We want to make sure the people we're hiring are sticking. And so we still have a little bit of work to do on that, frankly, but yes, we're incenting them. And the incentives begin to tell a story about motivation and that discrete effort. So
yeah,
yes.
And it's pay for performance, right?
That's right.
We answered Michelle's question earlier about the involvement of the hiring managers, but curious if has your team also thought about reducing the number of hiring managers, allocating backup hiring managers, and anything change around just the relationship with that important group of people?
No, we don't, but we measure the number of hiring managers each recruiter has responsibility for. And then our leadership team, the TA leadership team, actually will then go into the markets and visit with those people, spend some time listening, which I think is one of the key things, listening to what they need and what they need more of. And again, back to developing that relationship.
Great. Comment and question from Dov Hirsch. He said, first of all, this is amazing. So thank you for sharing today, Carolyn. So following these implementations, do you believe you've achieved balance in supply and demand for your organization? Or if not, do you believe the solutions you've implemented are going to enable the organization to meet or sustain talent demand in the near term?
Yes, in fact, one of the things that we began measuring, this was a new measurement for Ardent, was sort of this net hire, and so that we understood how we were doing and how we were performing against recruiting and retaining, right? And so we are at the lowest level we've been in terms of open rec since I've been here. So and it's been that way for about a month. So we've seen it drive down. So hopefully, my fingers are crossed. We're starting to see that supply and demand balance.
Great. One of the most important relationships is between HR and nursing. And sometimes it's healthy in some health systems and sometimes it's not. Can you share a little bit more about how you've built that relationship with nursing leaders, not just with your counterpart, but also across the organization?
Yeah, so I think that again, they've been part of the journey, right? We include them as part of those discussions and how we're doing things, and we have good relationships with the nurse leadership. So our nurse leadership here at Ardent understands what we're doing. We're basically in this together. I mean,
Yeah.
and so they are doing things as well, and we're working together to make some of this work happen, particularly around the academic partnerships, because not just from a recruiting perspective, but when we think about offering clinical rotations, that type of thing, we've brought on some relationships that in the past, because of, and this is what's been great about COVID is, you know, now more and more academic medical centers are doing some remote educational experiences for their nurses, and then we can offer the clinical side of it to them. So it's this partnership that works both ways, both from recruiting as well as providing clinical experience for the nurses.
Okay. So what would you say are your top 3 tips for your counterparts across the country who are trying to tackle very similar challenges?
Yeah, I would say, and you mentioned it, speed to hire is everything. If we're not the first to attract a good candidate, they will definitely go somewhere else. And second, I would say we have to provide the tools and resources that allow personal and professional growth in the organization. So we have to remember the whole person as we think about our people and our purpose. And then this may sound a little hokey, but I think we have to remember that we're dealing with human beings, not human doings. And we're all, you know, we all have a story, and we all need to be listening more.
And you do that in a variety of ways. So
Yes,
from the surveys to the one-on-one discussions with the executives, and yeah.
exactly.
All right. I think that concludes our webinar, Carolyn. Thank you so much. We got through all the questions too.
Great. Thank you so much for having me, Emma. I've enjoyed it.
Yeah, absolutely. And yeah, thank you so much for sharing your strategy and your tactics and your data. It's really, really helpful. Really appreciate it.
Okay. Thank you. Take
All
care.
right. Thanks, everybody.
Bye.